This Good Morning Washington Spotlight on Your Health is sponsored by George Washington University Hospital.
So with Breast Cancer Awareness Month upon us, now is the time to take a step toward keeping yourself as healthy as possible. And that's where Dr. Teal with the George Washington University Hospital comes in. Dr. Teal is the director of the Breast Care Center and the chief of breast surgery. First of all, welcome. Thank you so much for joining me.
Thank you for having me.
Thank you. So why is it important to get regular screenings for breast cancer?
We know that mammograms save lives. We have data from many years that there is a 30% reduction in mortality for women who get annual mammograms. Our recommendation is to start mammograms at the age of 40 and to do them every single year. And that's how we get the best mortality reduction from doing screening mammograms. It's a different case for patients who either have a family history of breast cancer, in which case we start them about 10 years before the age of diagnosis of the family member, and also for patients who have a genetic mutation that puts them at increased risk for breast cancer.
You mentioned genetics there, it's a big component. Can you get a little more into how the screenings change?
Absolutely. So for a woman who carries a genetic mutation, most commonly is the BRCA1 or 2 mutation, we start with MRIs at the age of 25 once a year, and then once the patient is 30, we start putting mammograms in the screening tool in between their MRIs.
Okay, so all of this, it sounds really scary. Hearing breast cancer, the word cancer alone is terrifying. So what would you say to someone watching who might not be making appointments out of fear?
We are believers in knowledge is power, and the only way for you to know if something needs additional workup is to have your mammogram. And just keep in mind, a majority of the time, mammograms are just what they're called, a screening tool, where patients don't have to do more than just the mammogram. But there are some cases where we like to supplement with ultrasound, such as if they've got dense breast tissue, which is a hot topic right now. And the goal is, if there is going to be a finding, that we find it early. And the only way to do it is to go in and get your mammogram.
And once it is found early enough, there are treatment options, right?
Absolutely. Most cancers are caught very early, and almost all cancers are very treatable. Our survival rates are well over 90%. And most women can keep their breast. We do breast conservation a majority of the time. Now, there are some women who choose to do mastectomies, either because they have to, based on the findings on their workup, or because they have a strong family history or genetic mutation.
So why is it important for someone to go to a breast cancer center like the one at the George Washington University Hospital?
The advantage is, for breast cancer and most cancers, it's a true team approach. And that's exactly how we treat patients. We have a full team. We discuss our patients every week in our weekly tumor board. We all know the patient very well as she goes through her journey, or he goes through his journey. And so having a team approach makes all of the difference for the experience for the patient going through their journey.
Incredible information you've given me this morning, Doctor. Thanks so much for joining me.
Thank you for having me.